Today's topic of discussion is case of HM, which actually established the link between brain function and memory. Okay, who was HM? HM was a patient whose full name is Henry Gustav Molaison. Henry Gustav Molaison. This case was very important in the surgical point of view because this case actually defined the link between memory and the brain function. First, we should know what is memory, and how it is linked to the brain functions, and which specific part of the brain control which type of memory. Okay, memory is actually retention and storage of learning behavior. Memory is retention and storage of learning behavior, and learning behavior is a type of behavior which actually depend upon previous past experience. Depending upon it is positive, it is negative. Okay, there are many classification of memory. Today's topic of discussion is about the declarative memory, so we will really concentrate on declarative memory. While memory is classified into two types, or on the basis of their type of information, first type is called declarative memory, and the next one is non declarative memory. What is declarative memory? Declarative memory is actually of any memory which involves the details of an, okay, any memory which involves details, whether it is factual details, whether it is about events. Okay, depending upon the nature of the memory storage. Okay, it is divided into two categories: episodic and semantic, depending upon nature of information that is stored. Okay, episodic information, yeah, episodic memory. Okay, episodic memory is a type of a memory which is involved for events, which is specifically about events. For example, for remember about their party, fun fair, sports week, sports gala, annual dinner. Okay, this in all this is regarding about events, and the memory which involves the events is called episodic memory. And the memory which specifically involves facts, it is also called factual memory. Okay, just like five apples, three mangoes, two walls, and three this all factual information. Okay, facts. And these facts, according the retention of that facts is called declarative memory, and specifically semantic memory. Okay, the first memory is declarative memory, which is nothing about actually details of various thoughts, images. Okay, informations. Next memory is a type of memory is non-declarative memory. First type is declarative, which is also called explicit memory, and second one is non-declarative memory, which is also called implicit memory. Okay, this memory is actually not a factual knowledge. It is not a factual knowledge about people, just like declarative memory is actually a factual knowledge about people, places, things, events. Okay, but implicit memory or non-declarative memory is not about factual information. It is actually, it is motor skills, skill power, motor activities. Okay, perceptual skills, all these skills which we learned, for example, to play a cricket. Okay, to play a tennis, to play a football. Okay, all the motor skills required for playing sports or any type of motor activity, this type of memory is called non-declarative memory or implicit memory. Okay, this is again divided into four types. One is procedural, second is priming, third one is classical conditioning, and associative learning. Okay, first type is procedural. We will not go into the detail because this is not our topic, but thoroughly we can say that procedural memory is encoded by striatum, cerebellum. You know, striatum is a part of basal ganglia, cerebellum, and the motor cortex. And priming is encoded by new cortex. New cortex means that cortex which is evolutionary well developed. Third type is classical conditioning, which is depending on amygdala and cerebellum. Amygdala and cerebellum. Amygdala for emotional response and cerebellum for motor response. Last but not least, non-associative learning, which is again two type: habituation and sensitization. Sensitization is positive memory, and habituation is negative memory, and this is dependent upon classical reflexive pathways. Okay, all these are the types of memories. Today's topic of discussion is about declarative memory. Okay, because declarative memory is divided into semantic and episodic memory. Semantic memory, which is actually in factual information. Okay, semantic memory is encoded by temporal cortex, specifically which part of cortex? Lateral and anterior temporal cortex and prefrontal cortex. These are involved in semantic memory, while the episodic memory is encoded by hippocampus and medial temporal cortex plus some new part of cortex, that is neocortex. Okay, so that today's topic of discussion is about hippocampus, so the main focus will be about episodic memory, which is a type of declarative memory. Okay, this was a general overview about memory. Now let us start our typical discussion about case of HM, Henry Gustav Mollison. Okay, HM was a patient who suffered from bilateral temporal lobe seizures. Okay, that hippocampus is the site of seizures. Okay, almost 90% of the seizures that occurs in the brain actually occur in the hippocampus. Why hippocampus is a site of seizures commonly occur in the temporal cortex, specifically hippocampus? Why? There is a scientific reason behind that. Hippocampus is a part of allocortex, and allocortex, specifically we will talk about hippocampus. It is histologically it consists of three layers. Outer layer is molecular, then not pyramidal, and last but not least multiform layer. Okay, molecular layer, pyramidal, and multiform. Only three layers are present in that part of cortex. Okay, and the three layers are actually less well developed. Okay, that three layers is less well developed, very simple in structure, only three layer structure. Okay, so that it is easier to excite that part of cortex. Okay, so that its threshold for excitation is very low or its sensitization is very high. That is why hippocampus is the site of most occurring seizures, and the seizures which occur for a recurrent spontaneous seizures which occur for a prolonged duration of time, such seizures are called epilepsy. Okay, so and that type of epilepsy which occur in temporal lobe is called temporal lobe epilepsy, which is also called psychomotor epilepsy. Okay, HM was a patient who suffered from bilateral temporal lobe seizures following a bicycle accident at age 9. That means that the underlying cause is trauma. His case provides understanding of link between temporal lobe and declarative memory. We already stated that the semantic memory is encoded by lateral and anterior temporal cortex plus prefrontal cortex, and the episodic memory is encoded by hippocampus plus medial temporal cortex plus new cortex. Okay, what is the clinical history? He had partial seizures. According to the classification of epilepsy or seizures, they are divided into partial or complex depending upon site of seizure. If the seizure is limited to one particular area of brain, and doesn't separate. Okay, doesn't separate. This such type is partial. If that separate and over a whole cerebral cortex, then such a seizure is called complex seizure. Okay, he had partial seizure for many years and then several tonic clonic seizure. Tonic means that spasm of muscle, tonic spasm of muscle. Okay, and clonic means that alternating muscle jerks. That means first agonist contracts, then antagonist contracts, then agonist, then antagonist, so that the cycle repeat. Okay, such type of seizure is called tonic clonic seizure. We will study in much detail in that topic of epilepsy. Okay, in 1953 HM undergo bilateral surgical removal of amygdala, which is again a part of allocortex, large portion of hippocampal formation, once again allocortex, and associated area of temporal lobe. After the removal of that areas, seizures were correct, but memory problems were created. What were the problems? We will study. Clinical manifestations after surgery. What are the four clinical manifestations after surgery? A grave loss of recent memory, that this person cannot learn new memories. Okay, this person cannot learn new thing. Third point is recall nothing of day-to-day events. he doesn't recall nothing of day-to-day events. Once again, memory problems. Fourth one is early memories were vivid and intact. This means that the previous past memories were vivid, were intact, but the formation of new memories were severely disturbed. This means that hippocampus is involved in the conversion of short-term memory into long-term memory, and the person with a hippocampal lesion or removal cannot establish new memories. So that we will clinically interpret that condition. After the clinical interpretation, it was found that short-term memory and implicit memory was intact. Short-term memory is also divided into three categories: short-term, intermediate, and long-term. Short-term memory and implicit memory was intact. Okay, this means that hippocampus is not involved in that memory. Normal procedural memory, once again, this is the part of non-declarative memory or implicit memory. Okay, so that he could learn new puzzles, motor activity. Okay, he can learn new motor skills activity. Once again, not a function of hippocampus. Third one is memory dysfunction of long term. Declarative memory is disturbed severely, and actually it is long term. Okay, patients have still short-term memory, but it cannot be able to convert it to long-term memory. Okay, this means that he cannot learn new thing, he could not memorize new things. Okay, such type of memory loss or amnesia is called anterograde amnesia. That type of amnesia which occurs after the lesions of particular structure. Okay, after the lesions. And the type of amnesia which occur before the lesions. Okay, in this retrograde amnesia, patient cannot recall previous past experiences. Okay, it is called retrograde amnesia. But retrograde amnesia is not due to a part of hippocampus. Retrograde amnesia is actually lesion of dorsal medial, specifically dorsomedial nucleus of thalamus. This is involved in the lesion of that part involved into retrograde amnesia. Okay, this means that hippocampus is not involved in the storage of declarative memory, hence no retrograde amnesia. Okay, this was the clinical interpretation. Still there are more. Memory deficit were permanent. Memory deficit were permanent and persistent and doesn't improve with the time. Okay, this means that no cortical plasticity occurs in this case. He doesn't know where object and continual use are kept. Once again, he cannot learn. Okay, intelligence, understanding, and abstract reasoning are intact. This means that prefrontal cortex is intact. Okay, these three are the function of prefrontal cortex: intelligence, understanding, and abstract reasoning. So that prefrontal cortex is not damaged in this case, because prefrontal cortex is present in frontal lobe, not present in temporal lobe. Finally, he could not remember having lunch at all. It is understood that he could have taken lunch about 2 or 3 hours. Okay, so that he could not remember. Once again, this is the manifestation of anterograde amnesia. Okay, this was the general discussion about HM case, Henry Gustav Mollison case, which actually established the link between the temporal lobe function and memory. Hope you have enjoyed this lecture. Thanks. Allah Hafiz.